All right. Hi, everybody. Welcome back. Happy New Year. I'm Dr. Buisson from Helping Hands Pet Hospice. We're doing this Facebook Live so that we can talk about quality of life in pets. We used to do this all the time, and I got out of the habit because things got a little crazy last year. So we're going to try to get in the habit of doing this hopefully monthly if I can manage it. And we're looking for some good topics. So if anything comes up that you really want to hear about, just send us a message. You can put a note in the comments. We'll read all of those, and we'll hopefully pick a topic that's important to you. So, welcome, and we are going to talk about quality of life today. And we don't have enough time to talk about absolutely everything, but we're going to go through a few things that we want to discuss. So the first thing that I want to pull up is our website, which is hhphospice.com. And on there is a quality of life scale. And we're going to show you we're going to put up a link in a little bit. I've got some questions I want to ask you first, but we're going to put up the link in a little bit to get you directly there. And we'll also show you how to navigate there. But for right now, I just wanted to show you this basic quality of life scale. And this is just kind of, I call it my quick and dirty questions. So clients who have questions about quality of life, these are the questions that I want to know first and foremost, because these are my biggest indicators of what's going on with your pet. So we want them eating. And there's a caveat to that some pets at the very end of their life, and if we're supporting them with hospice care, they will stop eating. But they're also not expressing that they're interested in food, and they are also not expressing that they're nauseated. And so for me, pets love food. Most of them, they love to eat. They live to eat. So when they stop eating, I feel like that's a big show that their quality of life is compromised. And we can often fix that with nausea medication and appetite stimulants. But that's a big red flag for me. So that's something that if your pet's not eating at end of life, we want to figure out what's going on there. We don't want them vomiting. I don't know about you, but I would rather do just about anything else than vomit. So if they are throwing up all the time, that's miserable. Nobody wants to live life like that. And again, some nausea medicine may be all that they need to make them more comfortable. And vomiting does not always, or they can be nauseated and not vomit, just like us. If you're nauseated, you're not going to go eat a big piece of fish out of the fridge. So of course, if you're serving your cat a big can of smelly, fishy food, if they're nauseated, they're not going to want anything to do with that. And so if we control nausea, then, we usually can control vomiting as well. But vomiting isn't the only sign of nausea. And a lot of people will tell me, oh, he's not nauseated, he's not vomiting. And I'm like, well, he's smart enough to know that if he doesn't eat, he's not going to throw up. And so he's just not eating. We want them clean and dry. So, a lot of pets at end of life lose mobility, and they're not able to move themselves away if they have an accident. Especially I see a lot in bigger dogs that go down and can't use their back legs. When they strain to try to stand up, they squeeze their abdomen. And sometimes, just like in people, that sphincter that holds all the urine in doesn't always hold up against real big abdominal pressure. So sometimes they'll urinate or have a bowel movement accidentally when they're trying to get up. And then a lot of them will panic and thrash around and make a big mess. So we want to make sure that their hygiene is good, that they're not getting burned by their urine or burned by their stool, especially if they're having diarrhea. They can get burned by it, and it'll actually cause a red, nasty rash on their skin. We don't want them in pain. Now, being pain-free at end of life can be difficult. I know I'm in my late 40s, and I'm in pain almost every day now from something. I have a very strenuous job, and I am an athlete, so it's hard to be pain-free. But we want them to be able to do most of the things that they would normally do. We don't want them to be anxious or afraid. So, pets with dementia, pets with just anxiety, pets who are painful all the time, because they, for me, I understand why my spine hurts, why my back hurts, why my feet hurt. But for a pet to suddenly experience pain, they don't understand why or what that's about. They'll lick that area or chew that area to try to keep it calm, or they'll keep a leg lifted up in a limp. If they can't, if it's uncomfortable to put on the ground, they're going to adjust their behavior to try to compensate for the pain. But it can make them very nervous and upset. So we don't want them to be anxious or afraid. We want them to love and hate all the things they usually love and hate. So if the Amazon delivery person is your dog's arch nemesis, and suddenly they come to leave a package and your dog doesn't care, something might be wrong there. Maybe they're too painful to bother getting up. Maybe barking is uncomfortable because they've got swelling in their neck, or their throat hurts. We just don't know. But again, that's normal behaviors that they do that suddenly they stop doing. If they love toys and now suddenly they can't be interested in toys, a lot of times that's dementia, or it's discomfort, or we just simply say they're old and tired and we stop playing with them. Sometimes we have to modify play to kind of, roll the tennis ball to them and let them chew on it, play gentle tug with them, so that they feel like they're getting something done. The old stinky dog that sits in the corner in his old stinky bed, and people walk by and pat them on the head, but they can't follow you from room to room, or they can't get up and go check things. They can't get up and go to the bathroom on their own. That's a pretty sad existence. So we want to be aware of those things and watch out, and make sure we're not seeing those kinds of signs. And we want them to have more good days than bad days. But I find for a lot of my patients, we're no longer at days where everything is good. We're at days where it's good hours or good minutes or good partial days. Some pets, the only joy they get is eating twice a day, and the rest of the day they sleep or they're miserable. And so we want to keep an eye on good times versus bad times, whether that's days or moments within the day. And really, these things aren't rules. They're just things for us to use as guidelines, and to say, if we're seeing issues with these basic 7 quality of life factors, that we need to get our pet taken care of. Get the vet to look at them. Let us know if we can help you with a virtual quality of life consultation. Let us know if we can help you with hospice care or euthanasia. So just keep those things in mind. That's our basic quality of life scale. Okay, so we're going to talk a little bit now. Cheyenne, you can close that out for me if you don't mind, and then we'll open it back up in a minute. So I wanted to ask, and I can't see. Cheyenne, can you send me a number of people that are here watching, please? Okay, perfect. Thank you. All right, so I want to know, can anybody tell me what a sign of nausea would be in a pet? I'm going to wait and see. And don't be afraid to answer. Like, seriously, this is not a big deal. And I'm just scrolling through my quality of life survey myself. Okay, so nobody. Oh, licking lips. Yes, Erica. Hi, it's good to see you. I hate that I can't see everybody, but if I put it on. Oh, yes, Deborah, drooling. Awesome. So nausea is one of my pet peeves in pets. I'm very phobic about vomiting. Like I got to knock on some wood. I haven't thrown up since I was a little kid. I've been sick and I've been nauseated, but I know how to manage it now. So I try very hard not to ever get sick because I hate it so much. And our pets do too, especially as the cat owners. Like, has your cat ever done that? Like, they start yowling and panicking and then they throw up and then they run away from it. Like, I just feel so bad for them because they don't know what's happening and they're just miserable. So things that we see with nausea, and again, vomiting is not the only sign of nausea. If there's one thing that I could get pet owners to believe, it's that pets can be nauseated and not eat. They can also be nauseated and eat, and they choose to eat and then throw it up later. But a lot of them will stop going to food when they're nauseated, because just like us, you smell something that smells strong and you're like, ooh, I don't want anything to do with that. I want food that's cold, and I want food that doesn't smell like anything. Like, that's all that I want. So yes, licking lips and drooling are definitely 2 of the options. All right. One more quizzy question, and that is signs of pain in pets, and crying can't be your answer. No crying, no whining, because pets often do not let us know that they are painful by making noise. In fact, they can be more quiet than usual because they don't want to draw attention to themselves. So can anybody tell me any signs that your pet might be in pain? I'll give you a few minutes to type. Hi, Carol. Welcome. Yes, Erica, hiding. Absolutely hiding, especially our kitties. Those kitties, when they hurt, they just want to curl up and be anywhere but here. Licking the painful spot. Yep, Deborah, absolutely. Absolutely. Okay. So yes, those are definitely two of the signs. There's lots of signs. So I want to have Cheyenne pull up our quality of life survey because basically I designed this to be a little different than the usual quality of life surveys that we see from veterinarians. It's just a checklist of signs and symptoms that you would see. So just scroll down, Cheyenne, past. This is on our website, which Cheyenne's going to give you the link to it in just a second. Poor Cheyenne, I'm like making her run all over the place. Sorry. So you can tell that I improv these things. I don't plan them out. So poor Cheyenne is like, hold on, I'm getting everything. Just give me a second. Okay. All right. So this is our quality of life survey. This is on our webpage. This is the link, helpinghandspethospice.com/quality-of-life. And you can get there also if you go to hhphospice.com. You can click on Resource Center and then scroll down to the quality of life survey. So there's Cheyenne's going to show you that because she's just awesome. And we have our blog, and then there's our quality of life survey right there. So you can find it there. I moved that, and our staff is like, where did the quality of life? Because we used to have a page for it that was on the main bar, and I forgot to tell them that I moved it. It's just messed everybody up big time. There's also a link to the quality of life survey in the comments now. All right, so let's scroll down past. This is all the stuff you would fill out if you wanted to submit one of these to us, which you can do at any time. Okay, so here's our first, is your pet painful? And so I just have a checklist of all the things that I usually see that cause pets to be painful. So hiding, limping, crying, like I said, vocalizing is not a common way to let us know that they're painful. They often just change their behavior so that they can be more comfortable. So instead of jumping up on the kitchen counter, they'll jump onto the kitchen stool and then up to the kitchen counter. And you would say, oh, well, he's still jumping. Everything is fine. But it's the height and the number of times that they're jumping. Same with climbing the stairs. They might have run up the stairs in the past, and now they take the steps one ginger step at a time. And steps were not made for animals, so they walk really funny up and down the steps when they're painful, and they can't just kind of skim right over them. All right, so signs of pain, hiding, limping, and the number of people who tell me their pet is limping but not painful in my almost 23 years of practice is just astounding. So limping is pain until proven otherwise. Some pets do limp because of a deformity or a problem that they had when they were young. They were hit by a car. But what you have to remember is that when the body has an injury like that, if you have legs that are uneven, that kind of thing, a spine that's curved, your body's going to compensate for that by having a different posture. So if your pet's been walking with the wrong posture their whole life because of an injury or a congenital problem, then you may see that they'll develop arthritis because they lean to one side, and so that side will develop arthritis faster. Or they lean forward onto their front legs and their back legs get really, 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 really skinny because they're not using those muscles as much, but they might develop more arthritis and more musculature in their front legs. Jumping less or less high, running less or less distance, walking less or less distance, disliking being touched in certain places. So you touch your kitty and they ripple their skin. That can be a sign that they're painful in that area. Or they used to love being brushed and now they're kind of turning to look at you like, hey, what are you doing? It might be because it hurts now. And chronic pain can make your skin hurt, kind of like when you have the flu and you have a fever and everything is so tender to the touch, you can't bear for anybody to touch you. Same thing with our pets. Chronic pain feeds back over and over until they're overreacting to it. And then even just brushing their fur, or heaven forbid, brushing it the wrong way, like rubbing your hand up their back instead of down, can make them very, very uncomfortable. Walking stiffly, having trouble getting up or lying down, difficulty turning. So that the pivot, for anyone who's a Friends fan. Every time I test pets for this in my head, I'm going pivot, pivot, because that's all I can think of is Ross trying to get that couch up the stairs. But they'll stand and then they'll turn, and sometimes their back feet will trip over each other, or they can't turn and they'll fall down. So difficulty turning around. And sometimes that's a great way to tell where they're lame, is to turn them to one side or the other, and you can tell which way gives them more difficulty. Climbing up or down the stairs, getting onto or off of furniture. So let's say we have a pet with a hip injury. They might have a lot of trouble jumping up onto furniture, but when they go to jump down, it's fine because they have no problems in their front legs. And sometimes it's all four legs and they have difficulty no matter what, but that can give us an idea of, our screen went crazy. Okay, whoa, we're back. Perfect. Restlessness. So I see a lot of pets, pain can get a lot worse at night because our natural anti-inflammatories go down and our natural pro-inflammatories go up. We also see more coughing at night, more anxiety at night. And then on top of everything else, like everything's quiet in the house generally. And so they have nothing to do but think about how bad they feel. So restlessness, pets that like wander from bed to bed to bed at night, or, that relentless clicky of their heels as they walk back and forth across the floor. Pacing, that can be a sign of pain, can also be a sign of dementia. And a lot of pets who have dementia also have arthritis pain and other painful ailments. Panting, dogs, cats not so much, but dogs panting when at rest in a cool area. If they're, if you're laying in the house and it's nice and cool inside and they're just panting like they're outside in the sun, definitely a sign of pain. Twitching their skin when touched, sleeping in unusual places or positions, licking, like Deborah said, obsessively licking parts of the body. So if you think about it, if you have a painful wrist, you might rub that wrist. Well, they don't have thumbs, so they can't do that, but they might lick that area and even create like a sore on that spot over a joint that's painful. A tense belly, whining, again, not as much as I see these other signs, but that's certainly a possibility. And Cheyenne's going to scroll us down a little bit. Crying out. So if you pick your pet up and they yelp or they turn around like they're going to bite you, or they do snap at you, definitely a sign. And then of course, there's an option that your pet doesn't have any of these signs. So those are ways, if you're ticking off multiple of those, then that's a real concern that your pet might need to be treated for arthritis. And while, joint supplements can sometimes help, and fatty acids can sometimes help, and CBD can sometimes help, these aren't, for later stage, these aren't by themselves going to do much once they have bone on bone arthritis. And there's, a lot of supplements out there and a lot of them don't do what they say or can't prove that they do what they say. So it's always good to have somebody managing that. And I'm going to give my standard warning. Please be very careful about anything you order from your pet online that is not a pharmacy, because lots of people can sell things on Amazon, and sometimes they come from other countries where we have found counterfeit products coming over, that the label looks almost exactly the same as the real product, but there's little changes, and then it either contains nothing or it can be even harmful to your pet. So make sure you get that from reputable companies, especially if you know that it's way cheaper on Amazon than anywhere else. That is a huge red flag for me, because I found stuff that's like $20 or $30 cheaper than I can get at wholesale. And I know that can't be the real product. So just be careful with that and with ordering those things. Just remember that all, supplements are not regulated here in the States. In other countries, they are. But here in the States, you can, pretty much package up anything. And if it's not killing a bunch of stuff, nobody's going to say anything. So be real cautious about those kind of things. We see, I see ads constantly for different things. And, it cured my dog. And you can say anything you want in a video. But if they don't really have any science behind it or any studies that have been done to show that it actually works better than, placebo, then it's a little iffy that you want to just give that to your pet. Okay, next thing, and this is a big thing for me, is your pet having difficulty breathing. So difficulty breathing is often an emergency. That can happen with pets who have fluid in their lungs, like congestive heart failure, where their heart can't pump fluid efficiently, and so it builds up in the lungs and makes them cough. It can be fluid outside the lungs. So the lungs can actually be working fine, but there's all this fluid around them, so they can't expand. So this pet that has this much breathing room now has this much breathing room. And that is really, really difficult for them to deal with. So some of the signs of that are breathing hard at rest. So again, panting. I don't usually see pets panting as much as I see them just struggling to breathe. And it looks just like if, I don't know about you, but like if I get on the stair climber for 5 minutes, I can't catch my breath. That's what it looks like. They can't seem to catch their breath. Panting can still be a sign, but I just don't see it quite as often, and definitely not as much in cats. If you see a cat panting, that is definitely something to bring up to your veterinarian, because that's not a normal thing for them. Cats like to breathe through their tiny little nose holes that are completely invisible, especially for our smushy faced cats. They do not like breathing with their mouth open if they can help it. Elbows sticking outward. So when they turn their elbows outward, it actually expands their chest and gives them more room to breathe. Breathing with their neck stretched way forward. So they're like trying to open up that area and lean forward to breathe. If their gums or the conjunctiva of their eye are looking anything less than a nice healthy pink, look at your own gums if you have a healthy cardiovascular system, and you should see that they're nice and pink. And your pet's gums should be nice and pink, unless they have black pigment. So if they have black pigment, that's normal, but you can always pull their eye down and see the pink underneath there. If that's blue or gray or pale, or heaven forbid white, that's definitely a reason to get to the emergency room or to your vet's office as quick as you can. Panting for no reason, using their belly to breathe. So if you're watching them and it seems like their belly is expanding the way their lungs should be expanding, that's a concern. One of the things I like to recommend to people is, if your pet's normal and healthy now, take a video of them just laying there breathing. Kitties, make sure the kitties aren't purring, because purring, I have been fooled more times than I can count by a cat who was purring and it looked like they were in respiratory distress. And then I, took their little purr pulse and they were purring like crazy. But if your pet is just sleeping, that's the best time to do it. Record a little video of what normal breathing for them looks like. And then if you have questions, take another video and compare the two and see the difference. Becoming tired or breathing hard very quickly when moving around. So your pet that used to run around all the time, they get up, they walk to their food dish, they eat a little bit, and then they're breathing like they've just been running. That's definitely a sign for concern. Coughing, wheezing, gurgling. That shouldn't say wheezing, gurgling. I'll need to fix that. Or no, my pet doesn't have any of these signs. Okay, next up is a change in appetite. So again, we're checking for certain diseases and certain things like nausea. So cats, especially stealing food and acting starving, that can be a sign of diabetes. That can be a sign of hyperthyroidism in older pets. We actually had a patient that his owner was heating up the oven to make lasagna, and they did it lazy like me. I don't preheat the oven. I just start the oven and shove whatever's in there, and then just check it when the time's up. But he was actually in the oven eating the lasagna, and his mom was like, "This is not normal." We also had another cat who stole a carrot from a baby, and we were like, "Nah, something's wrong with this cat. This cat didn't eat vegetables before this, and now all of a sudden we're stealing vegetables from family members." There are plenty of things. Sometimes bowel problems and upper intestinal problems can cause this too. But extreme hunger or extreme lack of hunger, those are definitely two things that we need to be concerned about. Hungry all the time, a somewhat increased appetite, normal appetite, and then all the decreased. There's picky, there's not eating much at all. A lot of cats, the only thing worth eating is treats. Like, they don't want any of their regular cat food. They want treats or table food. Dogs as well, and then not eating anything at all. And they can go an amazingly long time without eating. I'm just there are just times where I just don't understand how the pet is still alive. They've eaten so little. And often they lose a lot of weight when this is happening. So we definitely want to check on those things. And then I have on there, if yes, how many days? And boy, the numbers that I get are just astounding for how long they'll go without eating. Okay, next up is nausea. We talked about this a little bit. So you can see licking lips is on there, like Erica said. And I forgot now what Deborah said, drooling. And I don't know if I have drooling on here. But yes, that's a good one. So I'm going to add that on. So what happens when you do you write everything on your own website, you forget stuff. So going to food but not eating it. So this is a huge thing. Like they come in, they're hungry, and then they smell the food and they're like, oh no, I don't want anything to do with that. If they smell the food and then like lick their lips and kind of back away. I mean, just imagine a human face. If a human did those things, what would you think? You'd think, oh, that food doesn't smell good. Gulping, so swallowing really hard. For those of my fellow allergy sufferers, that gulping that you do when you've got too much postnasal drip and you can't get a breath, they'll kind of gulp when they see the food. Gagging, definitely. Backing away from food, so like they sniff the food and then they back up. Trying to bury it, that isn't always a sign, but it's something. If it's not something that they do all the time, it's definitely something to be concerned about. And then decreased, poor, or no appetite. So please, please, please remember, if your pet is not eating, their stomach is probably upset or painful, and possibly both. So definitely something to check out with your vet. Okay, next up is your pet difficult to keep clean and dry? So are we not grooming, or are we grooming more than usual? Are we getting urine and stool on the fur? Again, those things can actually burn their skin. The other thing that can also is excessive tearing. We may see ulcerations on the skin if their eyes are leaking. So we want to keep an eye on that. Mats and knots in the coat. For cats, one of my favorite signs of pain that I diagnose is that they are beautifully groomed from the shoulders forward, but they can't do the cat yoga thing and lick their rear end. Sometimes that's because they're overweight, but a lot of times it's just because they can't twist like that anymore. Also, kitties that are nauseated will often not groom as well or at all. Just imagine if you were feeling like you were going to throw up and someone gave you a giant handful of hair to eat, you probably would not be happy. So, when you're nauseated, you don't want to swallow food, but you most definitely don't want to swallow hair. So those are all some things to keep in mind for hygiene for pets. Let's scroll a little more, Cheyenne. Oh, there's more. Discolored fur from urine, stool, or saliva. So those white dogs that get the red staining on their feet, that can be from licking their feet, which is often a sign of allergies and itching. But it can also be a sign of arthritis. If they have pain in a certain joint, they may lick, and light colored dogs tend to turn their fur kind of a reddish brown. Sore spots on their skin from urine, stool, or saliva, smelling bad. And then, of course, if you don't have any of these signs, and then we have if your pet has an odor, what part of the body? And 99% of the time, people fill this out and tell me it's their mouth, because pets with dental disease and dental pain often have terrible odor from their mouth. And if we think it stinks, you can't even imagine what your pet thinks, because their sense of smell is so much better than ours. And dental pain is something very serious. If we're not going to do dentistry, which I recommend dentistry on almost all pets, unless they have some medical condition that we know for sure is a reason they shouldn't undergo anesthesia. But really, I've had dentistries done on 18-year-old kitties, and had them come through it. There's always a risk, but having a rotten mouth is a risk too. That's painful, and it can cause problems with the organs, and cause some pretty serious infections. So don't be afraid of dentistry. There are always those things that can happen, but your pet will never be as young as they are today. If you are thinking of getting a dentistry for your pet, go do it, because the chance of them developing problems in the time to come is very, very high. So they'll never be any younger than they are today. So as soon as you can, get that dentistry. February is dental month, so a lot of vets have specials on dentistry. Highly, highly recommend. It can make a huge difference. Let's see. Cheyenne says, what is the difference from licking the paws due to pain or from anxiety? Pain, itching, and anxiety are three things that can make them lick and chew. I don't see it as much from anxiety. Cats, some cats, not a lot, but cats will like overgroom their belly and pull their fur out if they're stressed. It can be other parts of the body too, but I see it a lot on their belly. That's a sign of pain in cats if they're licking at their belly, or especially if there's a little round bald spot right over where their bladder lives, which is just forward of their back, where their back legs meet their body. That can be a sign of bladder pain, and they're just grooming over that spot to try to get to their bladder and rub it, which they can't do. They can also be painful when picked up because it pushes on that painful bladder. But yes, wherever they're licking their paws, that should be something you're checking out with your veterinarian. And here in Florida, making sure that they are on flea control year round, because the fleas are just horrible here. Making sure that they're protected from those fleas, because I can't even imagine being old and painful and covered with little insects that are biting me all the time. I mean, that's just miserable. So definitely any abnormal grooming, you want to get that checked out. All right, next up, difficulty using the restroom. So difficulty urinating, frequent urinating. So a lot of older pets will get what we call PUPD. It's polyuria polydipsia, which is drinking more and urinating more. And sometimes you'll get the third P, which is polyphagia, which is eating too much. But any difficulty urinating more often, difficulty passing stool if it's too hard, having diarrhea, and keeping in mind that some pets, when they're constipated, will have diarrhea around the obstruction. So sometimes they will have both diarrhea and constipation, poor babies, because that's just miserable. Having accidents in the house, all of those things can be signs that they are having difficulty either with dementia. Urinating and having bowel movements in the house can be a sign of dementia. Asking to go out more frequently and then not doing anything because they forget why they're going out. But those can be signs of urinary tract infections, of bladder cancer. They can be signs of behavioral issues. So any change in their behavior as far as having your normal urination and bowel movements, definitely something to check out. And that's something every pet owner can see is taking their pet out for a walk or checking the litter box to see. So for kitties, if you always scoop clumps this big and now they're this big, or worse, the box like looks flooded, definitely a time to go take them in. If they have an accident and you clean it up and the urine is extra stinky, a weird color, clear, no color at all, that can be a sign of kidney disease. These are all things, any difference from normal, that's what we want to get checked out. Is your pet hydrated? So are they drinking more than usual? Are they urinating more than usual? Or not drinking or not urinating? If their gums are dry and tacky, so if your pet does not like your fingers in their mouth, do not do this because I don't want you to get bitten. But if you rub their gums and they're sticky instead of wet, that can be a sign of dehydration. If their eyes look dry and dull and they don't have an eye condition, that can be a sign. Sunken eyes. So pets that are dehydrated, their eyes can actually sink back in their sockets. And that can also happen with extreme weight loss because there's a little fat pad behind the eye that helps keep it forward. And if it sinks back, that's a concern. If you pull up the skin between their shoulder blades and it just kind of slowly oozes back into place, that's a sign of dehydration. It can also, especially in cats, be a sign that they've lost a bunch of weight. But it can definitely be a sign of dehydration. So those are all things to keep in mind. Vomiting, that one's easy. Yes or no. Although sometimes people are like, well, I found something and I don't know if it's diarrhea or vomit. Either of those things is a concern. There is no such thing as normal vomiting in cats. Cats do not vomit normally. Just because they do it all the time does not mean it's normal. Even hairballs, over time, that gets irritating to their GI tract and can actually set up some inflammation, or it can be a sign of inflammation that was already there. So we don't want pets vomiting all the time. That's definitely not a good thing to have going on. And then interaction, again, anything outside of normal. So are they still interested in the family? And sometimes you get a pet and they're just aloof and they're not a pet that really likes the family, and that's fine. Is it a change from what it was when he or she was in their prime? Interest in toys and playing. If they've never played with toys their whole life, that is not something to judge. But if they used to love to play with a toy and now the toys have been sitting in the box forever and they never touch them or look at them, that's definitely a concern. All right, a little more scrolling for me. And any other changes in behavior? So sleeping in weird places, hiding, pacing, whining, some of these things we listed above, but I wanted to have people, have other places to click on that. And then we have a place where you can fill in anything additional that you're seeing that seems weird. So panic, confusion, getting stuck, getting lost, those are all signs of dementia. Growling, biting, Pets who become aggressive with old age, it's often because they're uncomfortable. Something is wrong and they don't want that touched because it hurts. So don't punish them for that. Definitely take them in and get them looked at. And then this question is always hard for me because do you think your pet is unhappy? And people almost always say rarely or never. And then I meet their pet and their pet seems very unhappy to me. So we're going to have to delve into that a little bit about why my perception of their pet's happiness and their perception are two different things. But we can't ask pets if they're happy, but the pets that are so excited to see you and wagging their tail and, they're excited to go on their walks, they may go slower, which is a sign of arthritis. But if they're still showing enthusiasm for things, then that's a little different, and that's okay. But happiness is such a difficult thing to assess. Sometimes pets you can just tell they're a perky, happy pet, and now they're not. But if you have any issues with kind of figuring that out, let us know. It's certainly important to know what you think your pet looks like when they're happy. And I think I'll probably add that on there, like what makes you say that your pet is happy or unhappy. More bad days than good days. We discussed that. Is your pet anxious or needy? And we do, qualify, like, have they always been or have they never been? Some pets are anxious their whole lives, kind of like me. So, if they suddenly become anxious or they're clinging to you all the time, that can be a sign that something's wrong. Vision and hearing. Now, I have a blind dog, little Frida. She's been blind since birth. She still, even though she has all kinds of medical problems, she tears through this house and runs headlong into things and could not care less. So vision, loss of vision isn't necessarily a reason to say goodbye to your pet or to think that their quality of life is compromised. If they are getting around and doing fine, that's great. If it seems to cause them distress, then we're concerned. Same with hearing. A lot of pets go deaf at the end of life, just like people. And if it doesn't seem to bother them, that's fine. One of the things I do see a lot, though, is that pets will start to bite if they're startled. And so if you go to wake up your pet, they're in a sound sleep and they don't hear you coming. We have to sometimes warn them that we're coming, stomp across the floor, touch them someplace where they can't turn on you quickly so that you can gently wake them up. So that's, I know that was a lot to get through, but really this is so important and it's such an easy thing to just give yourself an idea of how your pet's doing. So feel free to fill this out and send it in to us, or don't, whatever, you can probably fill it out and then print the page and bring it into your veterinarian and let them talk to you about it. But we really want to know what's going on with your pet, what's different than normal, so that we can help keep them as happy and healthy as possible at the end of their lives. So, and sometimes if we address these things early, we actually can extend not only the quality, but the quantity of their life, how many days, weeks, months, and years they have left. So that's what we want to do. So I'm going to just quickly, I don't know if you guys just heard Shotzi sneeze really loud. Apparently she just woke up. I don't see any other questions. Please feel free to put some questions in the comments if you have them. I do want to tell you we are planning on, for next month, talking about when family members disagree about euthanasia. I'm going to try really hard to get one of my new friends who is a mental health professional to come on with me. If she's watching, she doesn't know that yet, so I'm going to have to call her and let her know. We keep talking about doing this and we haven't done it. But we're going to try to talk about that next month. So that's another place that the quality of life survey can really help. So if we have multiple family members fill out the quality of life survey without talking to each other about it, it's really helpful to get everyone's opinion. And it gives me a good way to guide you through the discussion as far as, okay, well, you're seeing these things, like let's take pain, for example. You're seeing limping and you're seeing all of these things. And your spouse isn't seeing any of those things. So why is that? Is your pet really good in the mornings? And that's when your spouse is there with them and leaves for work, and they come back after your pet is already asleep? Or do they work nights and they don't see that the pet's up all night panting? It's a great way to have concrete evidence of what everybody is seeing, and it gives us a better place to start a discussion rather than you're wrong or they're wrong. It's what are you seeing versus what are you seeing? Often too, the caretaker is either seeing way more or is not seeing things because they don't want to, because they're so attached and so unable to be objective. So it really does help us a lot. So we will talk about that next time, hopefully in February. You can send your questions to helpinghandspethospice.com/asks-doc-b. So you can find that on our website, and Cheyenne will put it in the notes too. Oh, Carol says, off topic, is 50 degrees too cold for Smudge to sleep outside? He has a self-warming pad, can even come into the garage with a heated house. But if that's too cold, I'll bring him inside. I brought him in last night because of the rain, even though he can walk into the garage, but I made him come in anyway. I don't think it's too cold, and he prefers outside. So Carol has a kitty, an outdoor kitty that adopted her. He came up to her house and adopted her. And she tries very hard to make him a pet and to bring him inside, but he doesn't get along with her other kitties. So she has very generously donated her garage to his care. I would say if he has the choice to come in and he does not, then he's fine. Pirate, my cat, is 15, going to be 15 in March. And he is outside in a screened catio, or we call it the cat batat. And it's so funny, as I get older, I'm much more protective of him and whether he's cold or not. So he has an electric blanket out there that's situated that he can get up and away from it while still staying in this little indoor enclosure that he has. So that goes on if it's below 70 degrees outside. And then he has a little heater, a little space heater that points into his little cat batat room if it gets below 50. And then if it gets below 40, I bring him inside. And just for the record, he hates that. And if he sees me coming and I'm pulling stuff out of the cat batat to put him inside, he has a fit. So my guess is that I'm way more sensitive about the cold than he is, but I'm not going to take any chances. So I think as long as Smudge has a choice, he's fine. And if he's got some form of heat to keep him comfortable, let him choose. But sometimes they like to be out in the cold, and especially if they have a nice Pirate's super fluffy. So again, he's got a little insulation against the heat, but he is really skinny, so not maybe as much insulation as he should have. You're welcome, Carol. All right, everybody. Thank you so much for tuning in. We appreciate you being here and participating. That's great. It makes me feel less like I'm sitting here talking to myself. We'll be back next month if we can do anything for you. If you have any friends who have elderly pets who need a little guidance or assistance or just a shoulder to cry on, we are here. Thank you, Erica, for being here. Thank you all for being here. I really appreciate it. But we're here for you. Please call us, send our information, share our website. We are a privately owned company. I'm the owner. Like I run this practice out of my home in Seminole. We are a tiny practice. We're growing, but we are small in the scheme of things. So if you can send us any clients that are having trouble that we can give our personal touch to, we are happy to do that. We want to be as helpful as we can. And of course, the sooner you contact us in your pet's disease process, the more helpful we can be, and the more we can help you plan. So we're here for you if you need us. Also, I wanted to tell you, because we've got several of our donors here, our American Veterinary Medical Foundation Angel Fund is going to be shutting down. The site is shutting down. We used to have a charity that allowed us to take donations and then give them to clients who needed assistance if they couldn't afford our services to come to the house for euthanasia services. But that is going to be shutting down as of March. So if anyone was planning to make a donation or feels generous enough to make a donation, we would be greatly appreciative. We can use the funds for as long as we want, but as of March, they're not going to allow us to donate anymore. We're going to be looking for a new way to do that, whether that's if we start our own charity or if we decide to use another service like this if we can find it. So please, there it is on our resources page. It's also on our main page. If you scroll down, it's that green color that you see. And you go there and you can do a donation submission form. Anything that you can donate helps. We have families that just need a little bit of assistance. We have families who need a lot of assistance. So we try to help everybody that we can. And we're so grateful for any help that you give us. So Cheyenne's scrolling down. It's way down on the page, but there it is. That's it. And that will be changing as of March. Like I said, we'll take that banner down and then we'll figure out what we're going to do. But there may be some transition time while we figure things out. So if anybody is willing to make a donation in January or February, we would be incredibly grateful. All right, that's it. We love you guys. Thank you so much for supporting us and for all you do to comfort our families when we post their memorials. And I mean, you guys are just, we could not ask for better clients and friends. So everyone take care, be safe, stay healthy. And I hope we don't get to see you or your pets for a long time. Bye, everybody.